Good afternoon and welcome to Community Conversations with the UI Cancer Center. I'm Chris Gay. If you're joining us for the first time, Community Conversations is a weekly show hosted by the UI Cancer Center where we highlight UI Health partners and community members, cancer information, and our different cancer-focused programs and interventions. Our aim, built around the UI Cancer Center's bench to community model, is to disseminate educational cancer and other health information to the community. Our guest today is Dr. Ben Gerber, Professor of Academic Internal Medicine and Associate Chief for Education and Scholarly Activities at the UIC College of Medicine. Thank you for joining us, Dr. Gerber.
Thank you for having me.
Dr. Gerber will be talking to us today about health promotional technology, community health workers, and health behavior promotion. So again, thank you for joining us. Can you give us a little bit of a background on your role at UIC?
So I'm trained as a general practitioner, primary care physician, internist, and I've been at UIC for about 18 years. I'm in their Department of Medicine. And when I started working there, I did mostly clinical work and gradually have shifted my focus to research, and now a majority of my time is conducting research, patient-oriented research, to promote health behaviors and to improve chronic disease management. It's something I enjoy working on a lot, and I find that there's a lot of challenges in this area.
Yeah, definitely. I mean, it's definitely a cool field to be in. Could you give us sort of a look into what sort of research you're doing right now?
Sure. So a lot of the more interesting research I've been involved with recently involves the use of technology to promote health behaviors and to improve chronic disease management. So these technologies could be using cell phones and receiving text messages, or receiving patient education information by computer with audio and video and various multimedia, and trying to use these technologies to help people live healthier lives. So the kind of health behaviors that we tend to look at are healthy eating, being physically active, and in the case of people with diabetes, checking blood sugars, and with other health conditions, taking medications on a regular basis. And we find that trying to use these technologies, and given that a lot of people have cell phones, that we're able to try and educate and support and guide people in terms of following healthier behaviors by reaching out through these technologies. So that's something that we've been getting more involved with recently, and something we're more excited about.
Yeah, really cool. I mean, and sort of going into tech, do you think sort of overall health and tech are evolving together? I mean, I know there's right now overall like a huge tech boom, in the whole world. Do you think health and health promotion is keeping up with that? It sounds like there's some cool ways you're combining the two.
Yeah. So the technology seems like it's moving fast.
Yeah.
So every time you turn around, there's something new coming out.
Right.
A couple of months ago, I don't know how recently it was, Pokemon Go is kind of the latest thing, and we were thinking, well, maybe people are going to go outside and exercise more looking for Pokemon. So things change very quickly, but the research world, I always think, is about 10 steps behind, or maybe 10 years behind.
Right.
So by the time someone comes up with an idea of using technology for a research project, they tend to write a grant proposal to get research funding to support their research, putting the protocol together, recruiting. All this takes a lot of time. Years pass, collecting data, years pass, analyzing data, years pass, and then by the time they're sharing whatever the results are with the scientific world, a lot of new technologies have come out, and people are doing different things. So it's strange. So a few years ago, people are reporting some things that they've done with Palm Pilots, and those are kind of like a technology that seems like in the past, but when they started proposing the use of it for maybe help keep track of what they're doing with their diet, it was considered probably more state-of-the-art.
Right.
So that makes it very hard for researchers to make sure they're using technology that other scientists would be interested in knowing how it works in the healthcare field. And then there's some technologies that are so new that people are maybe kind of afraid or don't know much about it, that they would feel comfortable using it in a clinical trial when we're still trying to address a lot of issues, which could be safety issues with devices, or it could be privacy and security of electronic health information. And there's still a lot of unanswered questions out there. So maybe with time, we'll be able to do a little bit better job of learning about the technologies in a more recent way.
Right. And I mean, it does seem like a really cool way to engage the community, thinking of, even for the Cancer Center and our community engagement model. Technology is something that, we've tried to use in a couple of our projects, but, to varying levels, but it's definitely, something that is already out there in the community, and it's evolving in its own right. And I think to tie health to that is really cool. To go, I guess, a little bit more into one of your research projects for like the texting and thinking of health promotion, is it work more as like reminders, or is it like, a way for people to communicate about their health? How does that project sort of work?
Right. So we have a few different studies that we're doing with text messaging, and we try a number of different strategies. For one study, it was on medication management, and a lot of it was just reminders about, it's time to take your medications, but it could also have some other health tips, such as you leave your medication about your toothbrush. You'll remember to take it every time you brush your teeth if that's part of your routine in the evening. So tips sometimes like that can be valuable, and sending them out by text messaging could be a nice strategy. We've also done two-way text messaging for a little bit of coaching for health behaviors, and we're still doing a lot of learning in that space. It depends on what someone's interest and capacity is for using their cell phone and being able to coordinate, so people are doing the texting in real time. The text messaging can also be used for surveys and for doing polls to find out kind of what's going on, or asking people at different points of time during the day what they're thinking, what they're feeling. Instead of what a lot of researchers do, is just say, in the past 2 weeks, we can ask people,
like live generated almost.
It's 8 p.m., how do you feel right now? Do you feel like raiding the refrigerator, or or something like that? So being able to kind of do that kind of reaching out to get in touch with people to find out more information, the text messaging can be useful. But and also we can use it for motivation. So for people living with chronic diseases, they have to manage their own health or take their medicines and do things on a daily basis. And they're a lot of times doing it by themselves. And it's nice to sometimes when they receive text messages from as part of our research study, they feel like someone's kind of looking after them, or there's some accountability, and that someone's kind of paying attention and cares that about how they're doing with their health. And so
almost like a more regular touch with like the medical sphere.
That's it.
I mean, it does sound cool, even in the way that is one. Working in the community, we found that there's a separation sort of anxiety where people either feel like they've been apart from it for so long, or that technology could help bridge that gap where or it's this bubble that seems almost inaccessible. But and there's a lot of different ways to make it more accessible from the health provider's perspective. But again, technology seems like a very cool way to even in a light sort of touch way give tips, and that's very, very interesting.
Right.
Do you have sort of any, cool stories or anything from someone who've been in your study, or, any impactful sort of results of this technology use?
We're still learning a lot.
Yeah.
We did a study with medication adherence with Dr. Lisa Sharp, my collaborator, and we looked and interviewed people after they received text messages to find out what they thought and what kind of themes were common among the participants. And so this kind of support and accountability was one of them. But a lot of times they thought it made them feel good, especially if there were a lot of positive messages. They found them informational. And a lot of times the advice was something useful. So we're learning kind of, some of these things about what their impressions are receiving the text messages. We haven't dug into as much in terms of finding out, do people actually become healthier when they receive these, which is really probably a more important question. We have a study that we're just now starting that will include text messaging and video conferencing in diabetes management. And for that study, we will look and find out, are blood sugar levels improving when they receive these technologies, as well as other forms of support. And we also, video conferencing will be a part of this, and seeing that if people have trouble making it to see the doctor or to see a diabetes educator or the nurse or other parts of their healthcare team, can they get a fair amount of support at home using technologies to help them with caring for their diabetes. So I think the future study will help us learn a lot more, find out, are people really actually, gaining better health, gaining more health from these.
Right. Cool. How will the video conferencing be used? Will it be like a way to talk to their provider, or what sort of capacity will that be used?
So in this new study, we're going to enroll approximately 220 patients from University of Illinois or UI Health, and individuals are going to receive support from a community health worker and a clinical pharmacist. And we're going to use technologies to kind of enhance that level of support. So a community health worker will have a tablet computer and can go into patients' homes with the tablet, and they can use that for video conferencing. And at the other end of the video conferencing is a clinical pharmacist. It's not the kind of pharmacist you'd see at Walgreens or a drugstore, but this clinical pharmacist is someone that actually works in the clinical environment within a clinic or within a hospital, and the pharmacist can go over medications and can help with a lot of issues that can come up with diabetes management. So that's one of the things that we've noticed, as well, as that community health workers appreciate that level of support about medication. So eating healthy is something that a lot of the community health workers we work with are very comfortable, and being physically active and walking more. But medications, once someone hands a list and it's got 15 medications on it, and there's side effects and changes in medication, no one's, the doctors are changing things. Things get complicated, and the pharmacist can be very helpful in that regard. And we think that the video conferencing may help that out. It doesn't require patients to go through the burden of travel and the scheduling, and they can actually do this in their own home.
Great, cool. And sort of going into community health workers a little bit, the UI Cancer Center, for a few of our projects in partnership with Miles Square Health Center and FQHC, sort of around Chicago, we use a few community health workers, but in a lot of different capacities. Sometimes as navigators, sometimes as sort of that bridge of education. Specifically thinking about the technology and maybe in other projects you've had, how have you used community health workers sort of in that way?
Right. So we are just finishing one study, and we found that the community health workers can be very helpful with providing a lot of information and emotional support, and like you mentioned, navigation is key, navigating the healthcare system, which is always very challenging. And I think sometimes just emotional support and listening to patients has gone a long way. So we're working with some community health workers that help patients with diabetes and high blood pressure, and with a lot of the medications that they take. And when they visit someone at home and they learn about patients' lives and really have a better understanding of what types of issues come up on a day-to-day basis, I think they can really be a great source of support. The other thing that they've been very helpful with is also trying to kind of bridge between the healthcare providers and patients. So the patients seeing healthcare providers, the visits are short. It's about it could be 15 or 20 minutes, and then the doctors is like, oh, look at the time, or I'm busy, and how much attention are they paying? But the community health worker can also connect with healthcare providers and also give them insights into their patients, what they're dealing with and why there could be issues. So one example that we've had with our community health worker is a doctor wanted to help a patient learn how to use an insulin pen, and the patient did not speak English well, and the doctor used telephone for interpretation. And at the end of it, the patient left and really didn't understand how to use this insulin pen, which is important.
Yeah.
You need insulin if you have diabetes, and couldn't use the pen. And so a community health worker went out and met with the patient and said, well, how did things go, and are you using the pen? And the patient says, I'm not using the pen at all, and because I didn't understand the instructions on how to use it, and using telephone interpretation was not very helpful. So the community health worker actually took the time and explained it, and in this case in Spanish, and so that the patient could ask questions and the patient understood, and then started using the insulin pen. And sometimes that can mean the difference between taking insulin and not taking insulin. And we think that things like that, which sound like they may not be a big deal, can be
Huge,
have a large health impact. So.
I mean, we've seen already how much of an impact community health workers can have. It's definitely cool to find those little stories where it's just it's a small bridge, it feels like, but it could really be huge for someone's health care. And even thinking about going back to the technology a little bit, does any of the tech you have right now have any sort of multilingual capacity? Are you developing any of that to, for the many different communities in Chicago and around the country?
Yeah, so one of the studies I mentioned, that's video conferencing and text messaging, will recruit Spanish-speaking Latinos that are receiving care at UI Health. Will be eligible, or they can be assessed for eligibility. So there they can receive text messages in Spanish and so forth. We've also done some work with multimedia education, which is showing videos for education. We've done that both in English and in Spanish. And we find that to be very important, because I think there's a need to have more educational materials available in Spanish. And I think kind of the intersection between both the technology that we're talking about and community health worker efforts is also kind of an exciting area, because I think that community health workers can also help get greater acceptance of various technologies for health promotion. And maybe in the future the community health workers can help patients with using apps or using Fitbit or tracking monitors to help people who are trying to do more walking or do more physical activity. So I think there's kind of a lot of interest and enthusiasm to find out if both of these strategies together may also be effective.
Yeah, I mean, they're two, I think, already useful tools that I think will only make each other stronger. And you mentioned the Fitbit, which I don't know if sort of a new technology that allows you to track your own personal health, how much you're walking, your heart rate, all that kind of stuff. Are you currently using it in a research project, or are you developing something around the Fitbit?
Right. So we have some proposed research projects, and we have one that is running with in the College of Applied Health Sciences that I'm collaborating on with some other researchers there, which is a walking program that focuses on caregivers and people with intellectual disabilities. But those individuals do get these monitors. I don't have any relation with the Fitbit company, but they have, you wear it on your wrist, and it, like you mentioned, it records the number of steps, it records your heart rate, and that really does give some more detailed information about how active people are. And also that is combined with coaching, which can include also through text messaging. There's been some studies so far, and there's still a lot to learn about this. So it's different than maybe 10 years ago, where we assessed by a questionnaire saying, well, how much have you walked in the past week? And it's really hard for people to judge how much they've done. But with these trackers, we can get a lot more precise information and get a better idea of how active they are, and then people can give goals. So you did 6,000 steps yesterday, maybe 7,000 steps the next day.
And yeah, it definitely seems like a cool way. I mean, with a lot of the technology you've mentioned, is to track and again get sort of smaller touches throughout sort of the health process for people. And I guess going back a little bit to community health workers and the involvement with technology, and have, I guess, with your research population, because your research studies are invited, right? They're not just in the community, correct?
Right, and they
Or
vary.
recruited, yeah.
Sometimes I feel like I kind of mix a lot of these up because they're
Oh, yeah.
drawing on
Yeah.
multiple studies. A lot of the studies that Dr. Lisa Sharp and I lead, especially on diabetes, we recruit patients that are through UI Health,
Right.
which may be Miles Square,
Mm.
as well as the Outpatient Care Center. And we've also worked with University Village in the past. But there's been some other studies that we've collaborated with that sometimes are conducted in various communities in the Chicago area, and have different types of recruitment methods, depending on the study.
Right. The only thing I guess I was going to ask is if the communities are people able to talk to each other about the technology? Because that's sort of also something that I've always found interesting about tech, is that it evolves through sort of word of mouth as well. Do your sort of research participants interact at all? And do you get any feedback in that way? Or is it still sort of like, people are out in the community using it and it's a sort of individual process?
Right. So I guess it's probably more in an individual
Okay.
way so far. We've had lots of discussions about, well, what if we shared messages? What if we had, say, used Twitter or social media, and people are doing more sharing that way? And then we're thinking, well, then you need a moderator too, also to make sure that the information being exchanged is appropriate and is good for everybody that's involved. And then, we're thinking, well, someone may be actually sending a lot of information. Other people may say, oh, that's too much, and but that's actually somewhat of a natural way people are using social media right now, and it attracts different individuals. So, for future research, we'd like to think about trying to do more tailoring, depending on what someone's interests and needs are. For someone who does like that more social environment, exchanging with people they know, maybe want to be in kind of more group conversations and maybe very active. Others maybe just they're willing to work one-on-one or really don't want to have as many interactions elsewhere. So I think there's different and unique ways depending on someone's own interests and how they want to use their cell phones or use apps or do text messaging. The other strategy too is there's something called just-in-time adaptive interventions, or they call them JEDIs, where we're trying to do a better job also providing information at the right time. So if someone is working on trying to eat healthier, and they find that on a daily basis at 5 o'clock they're kind of reaching into the freezer to pull out ice cream or something like that, maybe the time to act and intervene with the technology in the home is right before 5 o'clock, as opposed to, say, like 3 days before, saying, oh, for the next few days just start thinking about eating healthy. Maybe we need some ways to kind of reach them and prompt them and kind of direct them or motivate them or whatnot. There's a whole slew of different behavioral strategies at the time when they are going to be most involved with the behavior that they're working on. So I think that's very novel and kind of a unique way to think about it. There's an interesting study that was published not that long ago out of University of Wisconsin. And they looked at individuals that had alcohol dependence, and their phones would have GPS, and they would monitor where these individuals went. And if they were close to, say, maybe a bar or a tavern or something like that, then maybe the counselor would contact them. It sounds strange, but I think that might be kind of where maybe that's the future. I think all of us think about this, and it sounds concerning, and who's watching, and why would people want to have something like this? So again, I think it varies. Depending on what someone's interests might be. Maybe there's kind of unique set of technologies and that they can use with their phones or other devices, that works for them.
Yeah.
It's got to be very individual.
Yeah. So we actually have to wrap up, but thank you so much for joining us.
Oh, thank
Dr.
you for
Gerver.
having me. I appreciate it.
If you would like any more information about Dr. Gerver's research studies, you can go to the University of Illinois Cancer Center website or call us on our hotline, which we were unable to pull up on we will post with this YouTube page. Thank you very much.